All right, so today we're gonna show you what an assessment looks like when we're dealing with a patient with calf pain, Achilles tendon pain, and foot pain as well. So first we start in the foot. So we just want to check a few different ranges of motion. The first one we're going to check is how well the foot goes into dorsiflexion. So nice and relaxed here. So when we bring the foot all the way, this is dorsiflexion. So that's the first motion we're going to check. And we're just going to kind of test through the range here. We'll test dorsiflexion with both a straight leg and a bent leg. So when we test with a straight leg here, this is straight leg dorsiflexion. So Lori here has pretty good dorsiflexion in both her feet. That tests mainly the gastroc muscle. So again, that gastroc muscle actually attaches above the knee and then it joins at the Achilles tendon to attach in the heel. Now when we bend the knee and we test dorsiflexion this way, we're testing more tightness in the soleus muscle. So if we bend the knee and we kind of let the ankle go all the way up, this is more soleus muscle. And again, that soleus originates on the posterior tibia and then combines with the Achilles tendon to attach into the heel as well. So we want to make sure that we test both of those ranges with the knee bent and the knee straight. So that's the first check we do. Then we'll check plantar flexion. So we'll see how well her foot kind of does that toe point motion. So we want to see just checking how well that joint's moving, seeing if there's any end feel that doesn't feel like it should be there. So when we test that end feel, we want to check, does that have a nice soft end feel? Doesn't have any hard blockage, so we know that the muscles in that area aren't too tight. Also, we know that there's no bony blockage going on that could be impeding the motion there as well. So next we want to look at the big toe. So the big toe is important not only in calf pain, but also even in getting better hip extension. So there's been studies that showed with less toe extension, so if the toe is not moving as well this way, the hip and the glute actually doesn't activate as well as it could when you're running. So we want to make sure that big toe dorsiflexion or extension, another name for that motion, is doing well. In order to do that, what we do, we're going to take the thumb, I'll put it right under the toe here at this first metatarsal. So the toe, this long bone here for the big toe is called the metatarsal. And I'm just going to move this toe into extension. And what I want to see is that metatarsal, that head actually goes into plantar flexion as we extend. So this part should drop as that goes up. And on Laura here, that feels pretty good. However, on the other side here, we don't see that dorsiflexion of that big toe as well. So she kind of has a little bit of a hard end feel here. So that's definitely something we'd look at addressing for Lori's feet here as well. So after we check, we want to check again big toe dorsiflexion. We want to see how the whole foot dorsiflexes with the knee bent and with the knee straight. We're going to look at laxity, and we're going to check for any laxity in the joints of the feet themselves. So, you know, the foot has 26 bones. They all articulate with each other at somewhere in the foot, depending on what bone we're talking about. So we want to look at all those joints, make sure they're not too lax. We don't have to worry about any instability issues. Those are common after like ankle sprains. So we just want to kind of go through, test all the joints in the foot. In this particular one, we can take the cuboid, move that posterior, anterior, and just see how well that's moving. And the navicular here, and then if we come on the outside of the foot, we have the cuboid, so we can see how well that's moving as well. And again, testing the ankle joint here, we can look at shear force, so we want to kind of just like pull up and down, and we just want to see if there's any laxity there. So if I'm checking up, pushing foot into the hand here, we just want to make sure that that's moving really well. Okay, so we assess the different joints of the feet. Now we want to look at the muscles, and we're going to evaluate the muscles all the way from the foot to the hip, because again, with Achilles tendinopathy, you really want to look, or any kind of calf pain, you really want to look from the feet up. So the feet really form the foundation here, so we want to, make sure they're healthy and the joints are doing well, muscles as well. But we also want to look up the chain, so we want to see that the muscles, the glutes, the hamstrings, all of those are firing well as to not put too much extra stress on the calf itself. So in order to do that, what we'll do is we'll start with the calves here. So Lori, go ahead and point the toe down toward the floor there. So I'm just going to hold the ankle here. I'm going to press up. I don't want you to let me move your foot, so go ahead and hold.
Oh, sorry.
Yep, hold right there. Don't let me move you. Okay, good. And then same thing on this side. Good. So we're looking for any pain or weakness when we're doing that muscle test. So next, what I have you do is hold the foot all the way up that way. I'm going to pull here. Don't let me move you. Okay, good. And then on this side as well. Okay, good. So those feel solid, and we'd always evaluate, ask for any pain or discomfort during those tests as well. Okay, and then moving into the calf and the Achilles tendon. So the first thing we want to look at is this Achilles tendon here. So in some cases with a really bad Achilles tendinopathy, you can actually see an enlargement of this tendon. It's called a Haglund's deformity, and that's usually due to the tendon tearing and laying down scar tissue that it becomes a bit larger. So we want to observe for any deformities like that. Next, we'll kind of palpate through the tendon here, ask the patient if they have any pain. The most common sites of pain that we see are right at the insertion or anywhere like 2 to 6 millimeters above that. We find some pain in that area as well. So those are common areas. Again, and you can have pain really anywhere along the tendon or at the insertion itself. And then so right kind of middle of the calf here is right where the gastroc and the soleus meet. They actually form a septum, and when we have someone who's having calf pain or Achilles trouble, they generally have very poor movement in that septum due to scar tissue, adhesion development, or overtraining in general. So we like to work that out and just evaluate that area and make sure we kind of check it off the list, because it is a common area to have, again, that scar tissue develop and something that needs to be worked out with ART. So we check the calf. Next, what we'll do is we'll bend the knee. When we bend the knee, we put more slack on the gastroc, and we can evaluate more of the soleus, so from here down. This soleus muscle is actually still pretty tight on Lori here. She's a Ironman times 12 or 15 triathlete training for a, what are you training for right now, Lori?
Oceanside half Ironman.
Oceanside half Ironman. So all things being considered, for as much as Lori trains, she actually feels pretty good here, but definitely a little tight through here. So we want to look at, again, the calf, both muscles in the calf. We want to make sure we're evaluating them. We also want to look at that Achilles tendon as well. So in other cases, we will also evaluate outside muscles of the calf. Those are called your peronei muscles. We want to make sure those aren't too tight as well or compensating through that whole chain there. So, okay, so that's what our assessment looks like for when we have someone in the office who's having calf or Achilles tendon pain. In that assessment, we can also evaluate for things like plantar fasciitis, Achilles tendinopathy, calf strains, different problems that we see with the foot, especially in runners, big toe issues as well. Another common one we see in the office. So, but we always want to make sure that we're not just focusing on the area of pain, but we're also looking at the neighboring joints, such as the knee and the hip as well, because most of the time those are contributing in some way, shape, or form to the pain that's developing lower in the leg. Our job is to just figure out how that's going and what we can do to help that. So if you feel like you're having any calf or Achilles pain, especially related to running, go ahead, give us a call. Our number's right below, or you can click the link to check out our website for any more information. All right, take care.